The Menninger grounds are almost sacred.
There are certain places in this world that are special, and you feel it when you're there. The top of that hill and that Menninger campus was one of those places.
We love the beauty of this hill.
Particularly people coming in from the coast or other areas could not believe that you had this type of environment in Kansas.
And they selected this spot because of its beauty and because of its central location.
You're from Topeka, oh yeah, that's where Menninger is.
A lot of good work was done here, and good work will continue to be done here.
On a hill northwest of Topeka, Kansas, began a century-long story of progressive approaches to healing and healthcare.
In the late 1800s, when a Bostonian, lonesome for his forested Massachusetts, decided he'd put trees all over that hill, and in fact bought 1,000 acres around that area and started reforesting them. Topekans would often go out to the hill on hot summer nights because there was a benefit of a breeze. So apparently there was a trolley that came from town out to the top of the hill.
Before 1900, there was a plan to build a railroad from downtown Topeka out to, it was called Martin's Hill at that time. So the railroad actually got started because people like to go out there and picnic. They took people from Topeka out there and they'd picnic.
A group of Topekans got together. There were 11 of them, and each put up $1 to capitalize a new organization. This was called the Knights and Ladies of Security. I guess it didn't change its name until sometime later. As one put it, it's somewhat like a merger between the Elks Club and an insurance company. The purpose of it was to provide a kind of a womb to the tomb services of all kinds.
This was one of the first experiments of its kind in the country. People all over signed up to participate and pay a monthly fee and then know that they would have health care if they needed it.
Formed in 1892 with a very high-minded goal of providing life insurance protection for everyday working people. As you might know, back then, life insurance was pretty much the province of the rich, as were most financial products. So the idea of a fraternal organization, essentially a nonprofit, bringing assets together to offer a financial product to everyday working people was rather progressive.
Now, Security Benefit wanted a place to put their hospital, and they selected this spot. What they tried to put together was a benefit association, and that, if you look at the hospital on the hill, that's exactly, it not only covered illness, it covered orphans and older folks that needed a place to be. And that was it. It was like, maybe we can do some good for people.
Services for children, orphans, a service for seniors, and the entire hill became self-sustaining. So they had their own farm, their own agriculture, their own power source. And again, this is just really amazing.
In the early 20s, the buildings that were constructed, including the tower, which was a 250-bed hospital, as well as the power plant, which is the only building still there, with the exception of the tower, of course.
Security Benefit was a national facility. Regional hospitals were rare. Thus, people from all over the country traveled to Topeka to receive quality health care and assisted living in the years before health insurance was commonplace.
Security Benefit, things changed. It used to be around the turn of the century, First World War, people would travel to large clinics. With the advent of insurance coverage and this type of thing, people got a lot more treatment in their home communities. So there wasn't really a need for Security Benefit to have a comprehensive hospital where people could travel. So they began closing down things.
This was a time when Menninger in the old campus was searching for how to expand and where it could expand, and it was limited by the properties in the city. And so there was a fond eye looking west at that marvelous setting.
We had this notion of doing everything ourselves. So we did. We had our own education, as Walt says, our own research, our own hospital. We were, in effect, a community on the hill.
Menninger was very well known nationally. And at times in certain circles almost better on the East Coast and West Coast as it was in the Midwest. And it almost preceded Topeka. People would know Menninger and then Topeka in that sense. It was just that well known in the mental health field.
At one point we had some 1,200 employees, more than 400 acres of land. I don't remember how many buildings we finally built, 22 or 23. The patients often commented on what a place of serenity it was. It was undemanding, it was accepting, it was beautiful, it was reassuring. It had all these good qualities about it that were absolutely congruent with a healing institution, both SBA and ours. The intention was to make it unique, and it was. It was one of the few places in the country that tried to look at the whole patient rather than just what is his illness and can we fix that. It also added an element of hope.
We introduced exercise, positive attitude, nutrition. It's kind of interesting at a traditional psychoanalytic hospital to see the staff out. I was in my exercise attire, my running shoes, and the nurses were all dressed in their sweatsuits and everything, and activity therapists, everybody was out there. People began to realize that exercise was quite good, particularly for moderate depression. It was good. And also that fitness and wellness and an optimistic attitude makes a big difference.
Healthcare changed a great deal in the 1990s, and the reimbursement process changed. That made it much more difficult for a freestanding mental health hospital to exist.
It began to be clear that we weren't going to be able to stay here.
As Menninger moved out of state, another company would move its operations to part of the hill. In fact, the same company that got its start on that same hill decades before, Security Benefit.
A growing company needed new space and had a chance to go back to where it really grew up. And I think it's been an excellent move. In fact, if you look at any of our promotional material, we're very proud of our location and our building.
The Security Benefit story is so interesting also in that, in a sense, they were out there at one time, came downtown, and now they're back at the base of the hill, which was Menninger, all Menninger property that they built their current office buildings on.
This was from the ground up. It was taking what was a piece of essentially farmland and putting a very new age and very, I think, effective and convenient structure in place to grow a company. And if you look at it, even though it was built in 2002, it looks very modern even today. Visitors from outside the area come here and it looks like something you might see in Silicon Valley.
St. Francis purchased the rest of the Menninger property, but ultimately decided not to relocate its hospital to the hill. After a decade of standing vacant, the remaining buildings began to deteriorate.
The grounds themselves just mean so much, and the possibility of bringing that back, I think everyone always hoped it would in some manner, that we would have those same buildings being used again, and especially the fact that it could possibly be related to healthcare.
The Sunflower Foundation mission is to serve as a catalyst to improve the health of Kansans. We decided that maybe we should develop a permanent home that included shared office space and a convening center, a place where nonprofits could meet and learn and collaborate together. And so we set off to try to see how to do that.
In 2013, the Sunflower Foundation began to look at two of the historic structures that date back to the Healing Hills' earliest days a century ago, the Bohm Building and the Powerhouse. In these two buildings, Sunflower's Board of Trustees saw an opportunity to further its mission while establishing the 15-year-old foundation's first permanent home. The Bohm Building would be renovated as a shared office space for both Sunflower and other nonprofit organizations working to improve the health of Kansans. And the Powerhouse would be renovated as a cutting-edge conference center, a place for the state's nonprofits to learn from each other, collaborate, and energize efforts. Sunflower is currently working with architects and preservationists on renovation plans that will revitalize this part of the healing hill and preserve these buildings' proud heritage.
The past is important, but it's really all about tomorrow. And I think that we're starting a new chapter on Martins Hill. And I'm very excited about what it means to the work that we do as the Sunflower Foundation, but more excited about the opportunity to continue to build a strong nonprofit sector in Topeka and the state of Kansas, and the chance to be part of that rich heritage. So we're very excited about being part of the most historic hill in Topeka.
It's perpetuating a tradition that hill is therapeutic.
A caring environment is an important part of a good therapeutic community, and the hill was a marvelous setting for that.